If you have a Medicare health or prescription drug plan, you have only till December 7th to make changes for the next year. Joining us live via satellite is Raymond Hurd, Regional Administrator for the Centers for Medicare and Medicaid Services. Good morning, Ray. It's nice to have you with us. Why is this open enrollment period so important for people with Medicare?
Well, good morning. It's my pleasure to be here, and it's very important because this is the only time of year where people with Medicare can change their coverage options. They can look for a new prescription drug plan or maybe a new Medicare Advantage health insurance plan to better meet their personal or financial needs.
Why someone should consider a Medicare Advantage plan?
Absolutely. So Medicare Advantage plans have additional benefits that aren't covered under traditional Medicare. For instance, prescription drugs are not covered under traditional Medicare. Most Medicare Advantage plans cover prescription drugs, or we have standalone prescription drug plans that may be of interest. Also, there's other supplemental benefits that are in Medicare Advantage plans. Sometimes people may want vision covered. Well, traditional Medicare doesn't cover vision. Medicare Advantage plans might, and so you need to look around and see what's available.
And I know some people maybe have foregone prescriptions or certain other care thinking they may not need it or they haven't needed it up until now. But this is a good time to think about what you might need in the next year so that you would be covered for it.
Absolutely. I mean, this is the time when you're going to make the change for next year. Once December 7th comes, you're not able to make a change until next year's open enrollment period. So you really need to take a look and figure out what's out there.
Is there any other kind of penalty for people who miss that deadline?
So there's no penalty for missing the open enrollment period other than the fact that you aren't able to change your options. There are penalties that deal with your initial enrollment period into Medicare, but that's only when you initially age into Medicare.
Ray, what resources are available online for people?
So Medicare.gov is the best place to go. It's a great website. There's a compare coverage options tool there that will ask you 5 simple questions to help steer you in the right direction as to what you may want for coverage. You can estimate your Medicare costs for the year right there on the website, and then you can compare the plans that are available to you and even select a plan through Medicare.gov.
Sounds like a plan. Ray, thank you so much. And remember, everyone, open enrollment has already begun, but it ends at midnight on Saturday, December 7th. Make sure you have your choices made for the following year for Medicare and/or Medicaid.